a 19 or 20-year-old male facing advanced hair loss. This patient presentation illustrates how ethical behavior surrounds not only when, where, and how you choose to operate, but also when, where, and how you choose not to operate. Understanding the need to communicate the long-term impact and implications of hair transplant surgery is critical in the ethical management of these individuals. In practice, this generally means avoiding the creation of low, aggressive, and immature hairlines. It also infers understanding the need to avoid over-transplanting the crown as well, again due to overall supply limitations. Let's now look at a more pragmatic area of the hair transplant practice impacted by ethical considerations, that being appropriate assignment of staff duties. In general, this requires the physician, at a minimum, to follow the legal, local standard of care by discouraging the use of unlicensed non-physicians performing surgical procedures. In reality, ethical standards usually dictate an even higher standard of care based upon recognition that patients expect us, as their physician, to put their well-being above profit. Appropriate assignment of staff duties also encourages ethically minded hair transplant surgery physicians to adhere to ethically responsible behavior related to who manages clinical decisions affecting your patients, as well as navigating your patient practice guidelines for dictating the level of procedural involvement of your office staff. Following these staff duty guidelines forms the bedrock of a high-quality hair transplant medical practice. Next, let's consider truth in advertising and marketing. If there was ever an area ripe with ethical laxity, it is the arena of today's advertising and marketing behaviors. From incomplete or partial truths to flat-out blatant misrepresentation, patients are inundated with a widely swinging pendulum of expert opinions and observations. It is expected that ethical practitioners steer clear of these deceptive marketing practices.
Good morning. My name is Chang Hun Ho, professor of the Seoul National University, Bundang Hospital. Today I'm going to speak about the finasteride and dutasteride. The pathogenesis of the androgenetic alopecia is a miniaturization of the hair follicles. If the testosterone is converted to the DHT by 5-alpha reductase, this DHT acts on each hair follicles, and the hair follicles are getting smaller and smaller.